Hi, I'm Kim Curry, and I'm a student physical therapist at Campbell University. Today I'm going to be demonstrating the posterior sag, also known as the Godfrey sign. Before we get started on the actual test, I'm going to give a little bit of anatomy of the posterior cruciate ligament in the knee. So as we know, the knee is very susceptible to injury due to its location between the hip and the ankle. The PCL is located on the posterior aspect of the knee. It actually goes from the posterior intercondylar fossa of the tibia and runs to the medial femoral condyle. It controls 90 to 95% of the posterior translation of the tibia on the femur, and the most common mechanism of injury is if the knee is flexed and there's a posterior directed force through the knee. So this could be the dashboard injury in a car accident or just landing straight on the knee with your knee bent. So now that we've been over the anatomy for the posterior sag test, we're actually going to go over patient positioning and therapist positioning and what we're going to be looking for to see if there's a positive finding for the test. So I'm going to have the patient lie supine, and there are different sources state different ranges of motion for the hip for this test. Some say 45 degrees of hip flexion and some say 90. I'll demonstrate both. So the first one we're going to do is have the hips flexed to 45 degrees. I'm going to lift the table a little bit. And the knees should be flexed to about 90 degrees. And what you're going to be looking for is you're going to be assessing the tibial tuberosities to see if one is less visible than the other. If one is less visible, then it could be caused by a torn PCL, partial or full, and the tibia could be translating posteriorly on the femur. The other version of this is to have the hips, make sure to keep good body mechanics during this portion, and we're going to have the hip flexed at 90 and also the knees flexed at 90. You'll be assessing the same thing. You'll try to get eye level with the tibial tuberosities and see if one is less visible than the other. If you're unsure and you think there could be a possible tear, you could also ask them to slightly contract the hamstrings into your arm, and it would actually accentuate the tibial tuberosity not being visible. So go ahead and slightly contract. Good. A positive finding for this test would be the tibial tuberosity being less visible, and that could indicate a partially or fully torn PCL. Good. So now I'm going to demonstrate how I would actually explain this test to a patient. Hi, Kelsey. Hey. So today we're going to be doing some knee tests. I know you got in a car accident and you said you hit your knee on the dashboard. So a common injury for that is actually the PCL. Your PCL is one of the major ligaments in your knee, along with your ACL. And we're going to be doing a test that just tests kind of to see if that is intact or what's going on there, okay? Okay. So first, I'm going to get you to lay on your back. And I'm going to bring your hips and knees up into a certain range of motion, and you don't have to do anything, okay? Okay. All right, good. So just hold here. All right, and now can you slightly push your heels down into my arm? Good. Since it looks like this was a positive test, there could be some damage to the PCL ligament of your knee, and we're going to need to dive a little deeper into what's going on, okay? So now we're going to go over a bit of the statistics for the posterior sag sign, also known as the Godfrey sign. Not a lot of studies have really demonstrated the specificity and sensitivity of this test, but Rubenstein and Malenga have both stated that the sensitivity is around 79% and the specificity is 100%, meaning that anytime you get a positive finding on this test, it is 100% ruling in the disorder. Just like any other special test, we would want to combine this with a complete subjective and objective examination with our patients.